Hello everyone, now let us discuss about 2023 ICD 10cm coding guidelines for chapter 21 part 2. So chapter 21 mainly deals with factors influencing health status and contact with health services. It mainly deals with Z codes. In the previous session we have discussed about contact and exposure Z codes and Z codes regarding inoculations and vaccinations. Now in the current session we will be focusing on screening. Now coming to screening, screening is the testing for disease or disease precursors in seemingly well individuals so that early detection and treatment can be provided to those who test positive for the disease. The testing of a person to rule out or confirm a suspected diagnosis because the patient has some sign or symptom is a diagnostic examination, not a screening. In these cases, the sign or symptom is used to explain the reason for test. Whenever testing is done to confirm a suspected diagnosis, in that case you should not use screening codes. In these cases, sign or symptom is used for the reason for visit. And a screening code may be first listed if the reason for visit is specifically the screening exam, and it may also be an additional code if the screening is done during an office visit for other health problems. A screening code is not necessary if the screening is inherent to a routine examination, such as pap smear done during a routine pelvic examination. In this case, you need not code the screening code. And should a condition be discovered during the screening, then the code for condition may be assigned as additional diagnosis. This is important. When a condition is discovered during the screening test, then the code for condition may be assigned as SDX, not as PDX. And the Z codes that indicate a screening exam is planned. The Z code indicates that a screening exam is planned and the procedure is required to confirm that screening was performed. Now coming to the screening Z codes or categories of Z codes that describe the screening. The first one is Z11. It deals with encounter for screening for infectious and parasitic diseases. The next is Z12. It deals with encounter for screening for malignant neoplasms. The next is Z13. It deals with encounter for screening for other diseases and disorders, except Z13.9, that is encounter for screening unspecified. Finally, Z36. It deals with encounter for antenatal screening for mother. Coming to the first code, that is Z11.0. Encounter for screening for intestinal infectious diseases. The next is Z11.1. Encounter for screening for respiratory tuberculosis or encounter for screening for active tuberculosis disease. The next is Z11.2. It deals with encounter for screening for other bacterial diseases. The next is Z11.3. It deals with encounter for screening for infections with the predominantly sexual mode of transmission. The next is Z11.4. Encounter for screening for human immunodeficiency virus. The next is Z11.51. Encounter for screening for human papilloma virus, HPV. The next is Z11.52. It deals with encounter for screening for COVID-19. The next is Z11.59. Encounter for screening for other viral diseases. Next is Z11.6. It deals with encounter for screening for other protozoal diseases and helminthiasis. The next code is Z11.7. Encounter for testing for latent tuberculosis infection. The next is Z11.8. Encounter for screening for other infectious and parasitic diseases. And whenever the physician documents either encounter for screening for chlamydia or mycosis or spirochetal, in all these cases you need to code Z11.8. And finally Z11.9. It deals with encounter for screening for infectious and parasitic diseases unspecified. Next code is Z12.0. Encounter for screening for malignant neoplasm of stomach. Z12 deals with encounter for screening for malignant neoplasms. And Z12.0 deals with encounter for screening for malignant neoplasm of stomach. Next Z12.10, it deals with encounter for screening for malignant neoplasm of intestinal tract unspecified. Next is Z12.11, encounter for screening of malignant neoplasm of colon or encounter for screening for colonoscopy NOS. The next is Z12.12, encounter for screening for malignant neoplasm of rectum. The next code is Z12.31, encounter for screening for malignant neoplasm of small intestine. The next is Z12.2, encounter for screening for malignant neoplasm of respiratory organs. The next is Z12.31, encounter for screening mammogram for malignant neoplasm of breast. Whenever screening mammography is done, the code is Z12.31. The next is Z12.39, encounter for other screening of malignant neoplasm of breast. Next code is Z12.4, encounter for screening for malignant neoplasm of cervix or encounter for screening pap smear for malignant neoplasm of cervix. Next code is Z12.5, encounter for screening for malignant neoplasm of prostate. Next is Z12.6, encounter for screening for malignant neoplasm of bladder. The next is Z12.71, encounter for screening for malignant neoplasm of testis. The next is Z12.72, encounter for screening for malignant neoplasm of vagina or vaginal pap smear status post hysterectomy for non-malignant condition. Whenever we are coding Z12.72, if applicable, use additional code to identify the acquired absence of uterus that is given by Z90.771 category. It is further expandable. The next code is Z12.73, encounter for screening for malignant neoplasm of ovary. The next is Z12.79, encounter for screening for malignant neoplasm of other genitourinary organs. The next code is Z12.81. It deals with encounter for screening for malignant neoplasm of oral cavity. The next is Z12.82. Encounter for other screening for malignant neoplasm of nervous system. The next is Z12.83. It deals with encounter for screening for malignant neoplasm of skin. The next is Z12.89. Encounter for screening for malignant neoplasm of other sites. The next is Z12.9. Encounter for screening for malignant neoplasm site unspecified. And finally Z13 series. Z13 series deals with encounter for screening of other diseases. Z13.0 specifically deals with encounter for screening of diseases of blood and blood forming organs and certain disorders involving the immune system. The next is Z13.31. It deals with encounter for screening for diabetes mellitus. The next is Z13.21. It deals with encounter for screening of nutritional disorder. The next code is Z13.220, encounter for screening for lipid disorders, lipoid or lipid disorders, or encounter for screening for cholesterol level or hypercholesteremia or hyperlipidemia. In all these cases, the code is Z13.220. The next is Z13.228, encounter for screening for other metabolic disorders. The next is Z13.29, encounter for screening for other suspected endocrine disorder. The next is Z13.30, encounter for screening examination for mental health and behavioral disorders unspecified. The next is Z13.31, it deals with encounter for screening for depression. The next is Z13.32, it deals with encounter for screening for maternal depression. The next is Z13.39, it deals with encounter for screening examination for other mental health and behavioral disorders. Or encounter for screening for alcoholism or encounter for screening for intellectual disabilities. In all these cases, you need to code Z13.39. The next code is Z13.40. It deals with encounter for screening for unspecified developmental delays. The next is Z13.41, encounter for autism screening. The next is Z13.42, encounter for screening for global development global developmental delays or milestones, or encounter for screening for developmental handicaps in early childhood. The next is Z13.49. It deals with encounter for screening examination for other developmental delays. The next is Z13.5. It deals with encounter for screening for eye and ear disorders. The next is Z13.6. It deals with encounter for screening for cardiovascular disorders. The next is Z13.71. It deals with encounter for non-procreative screening for genetic disease carrier status. Encounter for non-procreative screening for genetic disease carrier status. The next is Z13.79. It deals with encounter for other screening for genetic and chromosomal anomalies. Next is Z13.810. Encounter for other screening for upper gastrointestinal disorders. And finally Z13.81. It deals with encounter for other screening for lower gastrointestinal disorders. The next code is Z13.818. It deals with encounter for other digestive system disorders. Next is Z13.820. Deals with encounter for screening for osteoporosis. The next is Z13.829. 828. It deals with encounter for screening for other musculoskeletal disorder. Next is Z13.83. It deals with encounter for screening for respiratory disorder NEC, not elsewhere classifiable. The next is Z13.84. It deals with encounter for screening for dental disorders. Next is Z13.850. It deals with encounter for screening for traumatic brain injury. The next is Z13.858. It deals with encounter for screening for other nervous system disorders. The next is Z13.88. It deals with encounter for screening for disorder due to exposure to contaminants. The next is Z13.89. It deals with encounter for screening for other disorder or encounter for screening for genitourinary disorders. And finally Z13.9. It deals with encounter for screening unspecified. Now coming to antenatal screening for mother, which is given by Z36 series. The first code is Z36.0. It deals with encounter for antenatal screening for chromosomal anomalies. The next is Z36.1. It deals with encounter for antenatal screening for raised alpha fetoprotein levels, AFP levels, or encounter for antenatal screening for elevated maternal serum alpha fetoprotein levels. The next is Z36.2. It deals with encounter for other antenatal screening follow-up for non-visualized anatomy on a previous scan. For that case, you need to code Z36.2. The next is Z36.3. It deals with encounter for antenatal screening for malformations or screening for suspected anomaly. The next is Z36.4. It deals with encounter for antenatal screening for fetal growth retardation or intrauterine growth restrictions, or whenever the fetus is small for days. In that case also you need to code Z36.4 for the encounter for antenatal screening for fetal growth retardation. The next is Z36.5. Encounter for antenatal screening for isoimmunization. The next is Z36.81. It deals with encounter for antenatal screening for hydrophytalis. The next is Z36.82. It deals with encounter for antenatal screening for nuchal translucency or NT. The next code is Z36.83. It deals with encounter for antenatal screening for congenital cardiac abnormalities. The next is Z36.84. It deals with antenatal screening for fetal lung maturity. The next is Z36.85. It deals with antenatal screening for Streptococcus B. The next is Z36.86. It deals with encounter for antenatal screening for cervical length. The next is Z36.87. It deals with encounter for antenatal screening for uncertain dates. The next is Z36.88. It deals with antenatal screening for fetal macrosomia. The next is Z36.89. It deals with encounter for other specified antenatal screening. Next is Z36.8A. It deals with encounter for antenatal screening for other genetic defects. The next is Z36.9. It deals with encounter for antenatal screening unspecified. Now let us see an example. A 60-year-old male patient presents to the outpatient radiology department for a lower gastrointestinal tract examination, and the physician orders documented lower GI screening, and the radiology report notes intestinal infectious disease in the lower GI. Here the PDX would be, or the first listed diagnosis would be Z13.811, encounter for screening for lower gastrointestinal disorder. Additionally, in addition to that, you can also quote Z11.0, encounter for screening for intestinal infectious diseases. Now let us see one more example. The guideline is, if a condition is discovered during the screening, you may assign the code for condition as additional diagnosis. This we have discussed earlier. For that, for example, a 75-year-old female patient presents to the radiology department for a left side mammogram, and the doctor orders documented breast cancer screening, and dense breast is found on the left side. That is diagnosed during the screening. So PDX would be Z12.31, encounter for screening mammogram for malignant neoplasm of breast. After that, in order to indicate dense breast, the code is R92.2, inconclusive mammogram. Under this you will find dense breast NOS also. So here the condition is given as SDX, not a PDX, because the condition is diagnosed or discovered during the screening. Let us see one more example. 26-year-old pregnant woman in her 30th week presents for GBS screening test. That is group B streptococcus. Here the code is Z36.85. Z36.85. Encounter for antenatal screening for streptococcus B. Followed by, additionally, you can use weeks of gestation. Z3A.30 to indicate 30 weeks of gestation. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.